Hi guys, welcome again. This is Maame'B Health 101. Today, we are going to continue our diabetes teaching. Yes, that's what we are going to do. I'm going to talk about the types that we have. On the previous video, we talked about the type 1 diabetes, the type 2 diabetes, and the gestational diabetes. So today, I'm going to talk about the type 1 diabetes. Type 1, yes, it's made up of about 10% of the people with the disease. Yes. Normally we say it is inherited, but to be frank, not really. People do not inherit type 1 diabetes itself, but rather a genetic predisposition or tendency towards development of the type 1 diabetes. But regardless, yes, regardless of the cause of it, is the destruction of the beta cells, yes, that results in decreased insulin in their body. So that is what causes it, yes, insulin production in the body. So somebody may ask, what is insulin? It is a hormone produced in the pancreas, which regulates the amount of glucose in the body, in the blood. Yes, in the blood. That is what insulin does. So these people with the type 1 diabetes do not have it. Yes, they have decreased insulin production in their body. That is what causes the type 1 insulin, the type 1 diabetes. That is why these people normally need insulin. Yes, they need insulin to survive on. And insulin is very expensive. Yeah. Without the production of the insulin, these people go through what we call DKA, diabetes ketoacidosis. Yes, that is highly acidic ketones bodies are formed. DKA is commonly preceded by a day or more of nausea, vomiting, polyuria. Yes, this happens to these people. Eventually, they go into coma. There's one thing that everybody has to look for. If you have a family member or a patient, yes, going into decay, is commonly characterized by a fruity odor breath due to the presence of ketoacidosis. Yes. So if they are having some fruity odor breath, please go to their aid, take care of them, and please help them. Okay, because it's really not easy maintaining this disease. The type 2 affects approximately 90 to 95% of people with this disease. Yes, it's commonly among people between the age, like above 30 years, yes, who are older than 30 years, and obese. These are the people who normally have type 2 diabetes. Yes. What are the problems that they face? That is, they have insulin resistance and impaired insulin. Yes. What causes these problems are unknown. Yes, it is not known with the impaired insulin. Signs and symptoms of type 2 diabetes are slow glucose intolerance, yes, polyuria, irritability, yes, poorly healing skin wounds. It's one of the big problems that we have. Yes, these people normally when they have wounds, it takes time, it takes a whole lot before it heals. Sometimes it doesn't heal. Yes, so we have to take notice of this. Normally, they are on pills, yes, tablets, medications. They don't take insulin. That is what they normally take to get better. Our next type of diabetes is the gestational diabetes. Yes, this is glucose intolerance with its onset during pregnancy. So this type of diabetes affects our pregnant women. So let's take notice of that if you are diagnosed with it, please follow your physician's orders. Yes, any order that they give you, because people with gestational diabetes have high risk for hypertensive disorders during pregnancy. So it's very dangerous. Yes, you don't want to play with diabetes. Yes, and this occurs because of secretions of placental hormones, which causes insulin resistance. Yes, during pregnancy. What are some of the risk factors for gestational diabetes? We have obesity, so you need to check your weight. History of it. Yes, maybe when you had your first baby, you had it. The probability of you having it the second time when you are pregnant is high, so let's take notice of that. Also, if you are diabetic, yes, maybe you have type 1 or type 2 diabetes, it's possible you go through it during pregnancy too. So let's take it. And family history, it also contribute to it. Yes, strong family history. These are some of the things that causes diabetes. So we also have the high risk ethnic groups, yes, like Hispanic Americans, Native Americans, Asians, African Americans. Yes, we Africans, it's also a high risk tendency. So let's take notice of that. Most women, yes, most women blood glucose level return back to normal after giving birth. Sometimes after giving birth, the gestational diabetes end up giving you type 2 diabetes. So you need to continue monitoring your blood sugar after birth for some time. Then your physician can tell you the end result, whether it's normal, it's back to normal, or now it has turned to type 2. As I said, you can move from one type to the other. Yes, like gestational diabetes turning into type 2 diabetes. So let's take notice of that. Then in America P diabetes esikyire yare ɛyɛ yare bi a ɛha yɛn ebibifoɔ. Yɛwɔ type 1, yɛwɔ type 2, yɛwɔ gestational yɛwɔ nyima diabetes na wonya no. Normally wonni diabetes but wobɛnyim no na wonya diabetes, wonya esikyire yare. Ɛno ho asɛm na meka no. Ɛno nso very serious because nkurɔfoɔ a munya saa esikyire yare sɛ ɔmo nyima, most of them no ɛma ɔmo nya blood pressure issues sɛ ɔmo go through that process a nti deɛ wo doctor ɛbɛka biara no ɛsɛ wodi so sɛna wo nkɔfa ɔhaw biara ma wo ho anaa wo ba no nti ɛsɛ yɛhu saa nneɛma wei. Deɛn ne deɛn ɛna ɛma yɛnya saa esikyire yare sɛ yɛnyim a woso anaasɛ wo weight no ɛyɛ over a ɛno ɛha adwene anaasɛ wowɔ diabetes ne dedaada anaasɛ ɛwɔ ebusua mu normally ethnic groups sɛ yɛn ebibifoɔ no yɛn so ɛha yɛn paa nti ɛsɛ yɛ taking notice of this sɛna wonyim na wo doctor ɛka kyerɛ sɛ now we need diabetes and say what we need diabetes, which is the gestational diabetes now. Say we follow instructions via or the bema sena enkoha wone wo ba no. Type 1 no head no normally ye ka say e wo ebusua mu eno ye dia eno obehia insulin ne boye den but say wo bo modern na utumi ehu nya wo be ye ne se wo fa ani bibia dia wo be fa no pa dia wo be fa sa na we didi hwe wo diet nso yie. Type 2 eno normally ye ma pills bi na wafa eno no wo produce insulin but ye ketwa nti wo hia tablet bi edro bi afa a eno so ebetumi aboa ama bibia akọ se na ese ekọ treatment. Diet changes, you taking your insulin religiously, your oral medications like the metformin, exercising, try and reduce fatigue too, and try and keep your A1C less than 7%, yes, to reduce risks of complications. Please, it's very important. So if you go through your diet, your medications, your exercising, this will help you to maintain your A1C level less than 7%. Thank you so much for having time to watch me. If you haven't subscribed, please subscribe. This is your girl, Maame'B. Bye. Thank you.